So I'm going to start talking a little bit about myself to give some context for this talk, how I got here, um, how we got here. I'm going to talk about superstition and rituals in surgery and the field of medicine, some examples, history behind those things, and how they fit into evidence-based practice and a field that can prides itself on being based in science and always pushing the evidence and really um, not doing things just because, but sometimes doing things just because. Um, and then, as typical for chief talks, I'll give some, I would say unsolicited advice, but I was asked to give this talk, so I think it's somewhat solicited. And the childhood photos, I think everyone really came here for. Done a lot of things to give at the end. So Dr. Najarian gave a nice brief overview, but for those who don't know, I grew up in a Navy family. My dad was a corpsman in the Navy while I was growing up, so we moved about every 3 years, mostly up and down the East Coast. It's all summarized in this nice and very easy to follow map here with all these arrows. There was a lot of back and forth, but like I said, mostly East Coast. I really enjoyed that in hindsight more than at the time, moving to 3 different elementary schools and being in new places that often. But now as an adult, I'm really glad that that is how I grew up. Like I said, my dad was a corpsman in the Navy. My mom is a nurse. So that's how I became interested in medicine. I really liked hearing them talk about their work, their patients, going to visit them at work. And I was just fascinated with that for as long as I can remember. After all of that moving around, my dad retired from the Navy, went back to school, and we all moved to Hanover, New Hampshire for him to do that and have been there ever since. So that has been my home since high school. It's kind of what I consider my home base now. It's very pretty. I think everyone should visit if they haven't. Very similar to northern Minnesota, but a little bit more mountainous, which I enjoy. And also where I spent my gap years while I was trying to figure out if I really wanted to do this med school thing after college. I went to college at Tufts University in Somerville or Medford, Massachusetts, depending on what part of campus you're on. I played lacrosse for 4 years there. It's like I never sat down for the whole time I was there. I did a lot of bench research, clinical research, kind of running around trying as many things as I possibly could to figure out what I wanted to do. So I was interested in medicine, but was really interested in pretty much everything. So I tried a lot of things out and ultimately took a couple gap years before deciding to apply to medical school after working in research full time, coaching hockey and lacrosse, taking the time to figure out if what I wanted to do. Ultimately went to medical school at Western Michigan University. I had never been to Michigan except for national hockey tournament. That's how most of the rest of my medical career has gone, just kind of finding new places to go in the Midwest and really liking them once I got there. Continued to try a bunch of different things in med school, was interested in pretty much everything. Absolutely did not think I was going to be a surgeon when I started. I thought that was something I was going to get out of the way. Picture on the top right is part of our first year of med school. We took a medical first responders course. And the local firefighters set up a disaster response day for us. Got to use the jaws of life, which is not something I've done a single time since then, but I don't have many opportunities to tell people about it. So this might be the only time that picture sees the light of day. Also took every opportunity to find every therapy dog in the hospital I can find. They're not just for patients. Med students, residents, attendings really appreciate them too. And then I made my way here to the University of Minnesota, the rural track. And met the best people. Happy that I ended up here. It's exactly what I was looking for in a residency program. Spending the first 3 years in the cities, last 2 years up here in Duluth. Just couldn't be happier with how all that has worked out. Picture in the bottom right is a selfie I took on my first day of intern year at the VA. Plan in the back of my head was maybe I'll take pictures every rotation or every first year of the academic year. That's the only selfie I took. I'm pretty happy and smiling. Things seem to have gone okay for the first day. And then starting a few months into intern year, people started telling me I was a black cloud. That wasn't really something I realized about myself. It was something people kept telling me or asking me. I think one of the first things Shelbi Olson said to me was, "Are you the black cloud in your class?" I was like, "What? I don't." She's like, "No, it's okay. Me too." And I thought that maybe that would I was just having an unlucky intern year, or this is how everyone's intern year was. It just didn't really get better. I came onto nights at Regents, one of the burn charge nurses just be like, "Oh, I'm so glad it's you," but also, "Oh no." Earlier this year, Dr. Najarian said, "It's a good thing you're pleasant. The worst cases just seem to find you." I was just flattered that she called me pleasant. It seems like maybe the highest praise that a New Englander could hope for in the Midwest. This has kind of just continued throughout my whole residency career. Like every so often people remind me of this, ask me how my cloud is. So here we would look into it and talk about it a little bit. So some definitions. Superstition. There are a few different ways this is defined in a lot of psychology, psychiatric literature, religion, mythicism, etc. Most general definition is that it's beliefs not based on reason or scientific thinking that we use to explain causes for events in ways that are connected to magic or connected not to reality, not to science, not to evidence. As an example of this, let's get the open tray in the room, ward off evil spirits, or let's get the crash cart outside the room, ward off bad juju. Ritual is any act or series of acts regularly repeated in the same precise manner, often in accordance with a social custom, protocol, or ceremony. So this doesn't have quite the same connotation as superstition of something that is not based in reality or not real. Things like our surgical timeout, which is very much based in evidence. It's still an act we do the same way every time. We have assigned a meeting to kind of signals the start of the case, that everyone is ready and on the same page and focused. We can also have superstitious rituals, which is a lot of the things that have become pervasive in surgery, and some of the things I'm going to talk about. Things like scrubbing the exact same way before every case, and not necessarily a negative thing. Some people have their exact way they do things every single time, or they set their instruments up the exact same way every time. Have their lucky scrub cap for hard cases, their specific playlists. At least one person who has their colon playlist, their hernia playlist, sets the tone for the day. The case gets to very much. Pam, would you be able to click play on that?
I would just click on it.
I knew there was 50 odds the video not working in a PowerPoint on Zoom.
I wonder if there's a link. Who's acted out for us?
I'll need some volunteers. Maggie, how about you?
Go.
Okay. Well, if this doesn't work, this is going to be a really great clip and a way to use up about 2 minutes. But it's an episode from an early season of Grey's Anatomy. not not a realistic or evidence-based source, but they fit about 10 superstitions into about 2 minutes. Oh yes, here we go. This becomes too epileptogenic. Not part of the plan.
That is not part of the plan. I'm trying to get rid of it and I can't.
Speaking of superstition.
Yeah.
What, it's playing now?
Is there a way to stop the stroke?
I wish.
I don't know if they're able to see or hear it in the cities. Can someone in the cities speak out loud if it's not playing either audio or video? Okay.
No.
You want to just pause it, Pam? I can play in Duluth somehow, but you know, it might not stop.
Really can't do this.
Get stuck in a Grey's Anatomy.
There you go.
Or the slides back up.
Oh, it really doesn't.
Okay.
A little bit
Briefly, just in the first 2 minutes of the episode, someone can't find their lucky scrub cap. Scene immediately cuts to catastrophic bleeding in the OR. Already been 2 deaths in the hospital so far. The guy that works in the morgue says these things always comes in 3 or 7, so everyone needs to be on their toes for the rest of the day. Yeah, there was one more that I can't remember, but the point is that these are kind of ideas that we don't even really think about as unusual in medicine or in surgery. We talk about these things all the time. Oh, these things always come in clusters. Like I'm sure we'll get another whatever consult before the end of the day, or don't have my lucky scrub cap today. It's gonna be a bad call. Or I brought my lucky call scrub cap, hopefully ward off evil spirits. And these things are very common in pretty much every medical show I've seen. There's just kind of ideas that are common throughout our culture. No one questions their existence in medicine, and just kind of how we exist. So in medicine, at least, we've universally come to describe people that are unlucky or have unusually busy call shifts can tend to get the most complex cases. Very unlucky at work is black clouds. The opposite is white clouds. People who are lucky tend to sleep all night on call. And this is a way that some of us describe ourselves and also the ideas that we have about each other. There are some the well-known black cloud. And this idea of black clouds, bad weather, storms and being associated with negative things, like misfortune, danger, impending doom, goes back kind of as far as humans have been writing things down. It's very common in literature. The Odyssey, these storms show up throughout the epic when bad things are about to happen, when the gods are trying to punish Odysseus, and so through a lot of Shakespeare's plays, Moby Dick, a lot of the we would consider classic literature. I wasn't able to pinpoint a specific time or person or place where kind of started using this terminology and this imagery to describe ourselves and our colleagues in medicine, but I would say it's a universal terminology. And you say that someone is a black cloud, everyone knows what you mean. Is that a real thing though? So of all the superstitions in surgery, this is one of the things that people have actually tried to study the most. We want so badly for this to be a real thing, to explain why some people feel unlucky or busy. And to get to the chase, that hasn't been proven in any of the studies that I found. This first one on the top, the urology program studied 4 urology fellows over about 15 months, with one of them describing themselves as a black cloud. They actually created kind of a black cloud index based on how much people complained about being black clouds. This is kind of a self-selecting, self-described thing. And they followed these 4 people for 15 months and measured a few things over their call shifts, the number of calls they got per shift, the number of shifts they considered high call or over 5 calls over the shift, and the frequency that they got early morning or dawn time calls between midnight and 5 a.m. And all of those measures were almost perfectly equal across those four people. Despite that, the one person who described themselves as a black cloud at the beginning of the 15 months continued to do so at the end of the 15 months, despite the data. And then this other study I found, conversely to this self-described black cloud, the first study, they stratified people based on who their colleagues considered black clouds. So physicians who had been in this tertiary care emergency department, after their 6 months, was able to kind of identify one of their colleagues as either a black cloud or a white cloud. And they followed all of their shifts and labeled, depending on who was there covering the shift, as either a black cloud shift or a white cloud shift, and measured the events of the shift, how many red were severe triage patients they had, number of admissions to the hospital, number of admissions to the ICU, resuscitations, trauma team activations, and deaths while on shift. And none of those had any significant difference. They actually found that some of the black cloud shifts had, although not statistically significant, fewer number of events than the so-cloud white cloud shifts. So what I took from finding all these attempts to kind of quantify black cloudiness and try to figure out if there were some people who were truly statistically unluckier than others, is this black cloud phenomenon really reflects more of a subjective perception than an objective workload. It's more of a state of mind than a true trait or state of being. And we'll come back to that. Another common superstition in the world, but also in medicine, was Friday the 13th being considered a particularly unlucky day. Just think bad things happen by chance more often than some other days. And this superstition actually started as 2 separate ideas of being unlucky. The number 13 has been considered unlucky, associated with misfortune, also since ancient times. This comes up in the Bible several times, in Norse mythology. and cultural examples predating those things as well. In a lot of religions, cultures, 12 is considered a complete or a whole or a lucky number, signifying things just the 12 months in our calendar year, 12 signs in the zodiac. It's kind of considered a complete or auspicious number. So add 1 and get to 13. It's considered irregular, disruptive, chaotic, now that you're not at that 12 number anymore. Fridays have also been considered an unlucky day in Christian European tradition. Again, with origins from several events of the Bible, bad things being described as happening on Fridays. And sometime around the 18th, 19th century, people started describing the combination of these things as extra bad. People avoid going outside on Friday the 13th, avoid doing things they might consider dangerous. Nervous to be on call on Friday the 13th. I actually found, looked into both the Friday the 13th movie enterprise and a novel by the same name released in the early 1900s that actually made this idea more pervasive. This was not always a belief that people held. And this is another superstition that people have made multiple attempts to look into to see if this is kind of a real thing, if more bad things happen on Friday the 13th, or if it's just all in our heads. This is the largest study that I was able to find looking at surgical outcomes on Friday the 13th, as opposed to what they called flanking Fridays. So whatever the 2 Fridays on either side of a Friday the 13th were, they used that as their control group to compare to patients that had surgery on Friday the 13th. And they looked at a wide range of specialties: general surgery, cardiac, neurosurgery, ortho, gyne, vascular, and across multiple complexities of surgeries, emergency, elective, and found no difference in any of the negative outcomes on Friday the 13th. It's not terribly surprising, but have the data to prove it. So we have all this data arguing against kind of these superstitious powers that be. Why do we continue talking about these things, doing these things, having these? Well, I do this because it helps me sleep at night, type things. One is that this is a learned behavior. We talk about black clouds and Friday the 13th and the full moon and saying the word quiet on call or quiet in the ER, looking at the ER list, being unlucky. And we all just start believing these things. The black cloud phenomenon in particular, in the psychology literature, have described this self-fulfilling prophecy, an availability heuristic. Essentially, you believe you're a black cloud, and then unlucky things happen or bad things happen. You're like, see, I knew it. The black cloud strikes again. Or when those unlucky things do happen, we're more likely to remember these things. Getting those 2 a.m. calls, or the bad complication coming in when you're on call, the terrible nonstop night of consults, and so you see it's the black cloud. Friday the 13th, full moon. Though, as far as surgical outcomes that people have measured are concerned, I haven't found, and similar to the paper I talked about, that there are worse outcomes, but for some I found slight increases in mistakes or complications that weren't statistically significant. I think this may be attributed to people bringing that stress that they're already stressed about the day. Like, this is an unlucky day, I'm unlucky. When you're in that higher state of stress, you bring an increased amount of mistakes. Brings us back to self-fulfilling prophecy. But these beliefs and these superstitions are not always bad. It's not all a negative thing. Some of these rituals, like having a lucky scrub cap or having your routine before surgery, or even avoiding certain words because you think that helps, it gives us a sense of control in an area of life, an area of medicine where there are a lot of things out of our control. We can't control everything about our patients, can't control when the emergencies come in, when the complications happen. So if you feel like you're going to have a better time because you're a lucky scrub cap or because you set your instruments up a certain way, because you did your favorite pre-op scrub, had your favorite pre-op snack, then it improves your confidence and kind of settles the mind, puts you in a better mindset for going into whatever it is you're about to do. People made a lot of comparisons between medicine and particularly surgery and pilots and athletes. That's a large area of study and something we talk about all the time. And this is something that we see examples of in those studies in particular. Very famous tennis player. The remote. Okay. It's like this is one of the most common visible examples of someone who has a very set, very predictable kind of pre-match routine. People notice it, comment on it, take pictures of it. Always gets his strength set up just right, certain taps before the serve, and does it the same way every time. And I liked the way that he described the things he does before his match to make him feel ready. I do these things, it means I'm focused, I'm competing. It's something I don't need to do, but when I do it, it means I'm focused. And to me, that was the most important part, that he recognizes that, he does these things because they make him feel ready. They put him in the right mindset for the match to compete, kind of signal to him psychologically, physically that it's time to go and time to compete. But he recognized that he doesn't need it, but it helps. And I think that's an important thing to keep in mind when we have these rituals or superstitions that make us feel good going into surgery. Do it, but if there's something that keeps you from your lucky scrub cap, your favorite playlist, it's not something you need. It's something that helps, but it's not going to derail the whole day. It's not going to bring evil powers to the OR because it didn't happen. Just some brief, mildly solicited advice. We heard from Alyssa earlier in the year. She gave us some advice from Commander Brandt, so I thought I should share some advice from Senior Chief Gallimore. One of the things he always said to me as I was growing up is that you can learn just as much from a bad leader as a good one. Something he usually said when I was frustrated with a coach or a teacher, I didn't feel like things were working well for me. I have generalized this to, you can learn just as much from a bad insert example here is a good one. A bad case is a good one. I'm not thinking of bad leaders or bad teachers here, but I think everyone has probably found people that their learning style doesn't mesh with a certain person's teaching style, or they don't think that a consult is appropriate. I think you can just learn as much from a bad situation as a good one. If you only wait for good situations, good teachers, good cases to decide to learn from it, then there's not going to be enough learning happening at all. So there's something you can take from everything. Similarly, I think a lot of the junior residents, my colleagues, have heard me say at some point, anything can be a learning opportunity. I think that often probably sounds sarcastic. Often when there's another consult in the ER or something that doesn't sound like really fun to do, but I truly mean it. Kind of in line with the learning from bad situations. I really think you can learn something from just about everything, even if it's not what you were planning to learn or not what you exactly wanted to learn that day. And count the dogs. For those that are lucky enough to not follow me on Strava, I'm a very slow but very consistent runner. And when I go for runs, what I do is I count the dogs that I see along the way. Every time. So it's something that and it gives me just gives me something else to do when I'm running. It's not something that I'm very good at, so sometimes that can be frustrating for me. But counting dogs along the way gives me something fun, something to celebrate both along the way and kind of count at the end. I'm excited that I saw at least one dog per mile. And I use this idea in other things as well, as kind of celebrate the small things, the small wins. We talked about this in lacrosse a lot, because like not just celebrating goals or saves, but also defensive stops, picking a good celebration. So the more little things you can find to celebrate and appreciate, it makes the annoying things less annoying. So with that in mind, just a few of the dogs that I've met throughout residency and share that idea with all of you. Malta Calling got 2 places on the slide because she's been a member of the trauma team multiple times recently. I love having her. I always find the therapy dogs in the hospital, but also find other little things to appreciate when I'm at work with my co-residents. If you don't find fun little things in the hospital, I think you're missing out at work. Moving on to some thank yous. I did not find everyone's individual headshots on the website to put up here. I hope that everyone feels thanked despite not seeing your own thumbnail size photo. But in putting this together, actually listing all of the sites that we rotate at, especially on the rural track, just really thankful for all of the different clinical sites, different practice types, specialties, practice patterns we get to see. And just thinking about the immense number of people that have invested hours into my education, my colleagues' education. Just really grateful, even just looking at this list. And also wanted to kind of shout out also our subspecialty off-service colleagues that we rotate with a lot in Duluth. Of course, grateful for the general surgeons, trauma surgeons they spend most of our time with. But grateful for especially the vascular and the OB-GYNs that let us into their world a little bit, despite us not being as trained in their specialties as they are. My co-residents, when people say, without fail interviewing for residency, that's the people that make it. These are the people they're talking about. Been lucky enough to be part of 2 classes as the rural resident going straight through, not taking lab years. Very grateful for the intern class I started with. You guys should come up to Duluth sometime. And also the class that I'm graduating with has welcomed me in and been such a strong support system throughout the year, even though I mostly exist in the group chat and not in person. Thank you to the intern class I started with. I was somehow on call for almost all your life events, our intern year, birthdays, weddings, etc. And they made sure I was included anyway by taking pictures with a picture of me. And my family, despite not really knowing much about medical school and definitely not much about surgery residency or even what general surgery really is, have been supportive of every idea that I've had from I'm going to go to med school to I think I'm going to be a surgeon. Raised an eyebrow, but they've been supportive the whole way, including coming to Minnesota for the first time to visit me, which I appreciate. Kara and I met in college our senior year. So when we met, I could not even buy a drink for myself. And not even considered taking the MCAT yet, didn't know what I wanted to do. We were both figuring that out. So she has really been there from the beginning of this crazy idea that I was going to go to med school and then going to be a surgeon and then going to be a rural general surgeon. Has kept me fed, watered, and with an appropriate amount of sunlight when possible. Residents are like anxious house plants. Also just been there for everything, and we got married last month. Fitting all of the major life events into the last few months of residency. And if you're looking for me next year, come to the Finger Lakes. I'll be a general surgeon in Auburn, New York. And that is all I got. Questions, comments, superstitions?
This is Dr. Kramadine. Can you hear me?
We can hear you. Can you hear us hearing you?
I confirmed I can hear that. That was a great talk, and you know, I was fascinated. You introduced sort of full moon in there. You know, there is something to that. Before we had electricity, when I started, out more on a full moon, as opposed to not, and so. Certainly, accidents involving animals and other things like that were more prone to happen. I don't know if it's statistically more valid. But black cloud does walk out of full moon, so they do negate things at times. But I thought that was a great talk. I think I spent a lot of time in upstate New York. I think you'll love Auburn. It's quite a remarkable area if you haven't spent a lot of time there. So that'll be a really enjoyable place to live and work.
Rachel, hey, it's Nugent. Excellent talk. I have such fond memories of our time together when I was a resident, and it's so nice to see you graduating. I remember, I think it was at the VA, your second year, and that's kind of plodding along. It's the best way I can put it there. And I also was curious about the full moon because it does, did you find any data on if there's any difference in the full moon dates? Because it does, I feel like at one point I looked this up and maybe it was with you. I remember a couple times where we were like, what is happening? Oh, it's a full moon.
I didn't find any data about the full moon, but I know this kind of contradicts all of the data that I found and talked about, but I think there's just got to be some importance to understanding that there's things we don't understand and aren't going to be reflected by data and dealing with our lived experience.
Very insightful. Thanks for your time, Rachel.
Hey Rachel, it's Cheyenne. Just want to say I have been so proud to be able to call you both a colleague, a friend, a bridesmaid these last couple of years. I'm just very proud to have known you, and I'm very excited for your time in Auburn, and I will be visiting you. So stay tuned.
Hey Rachel, it's Sean. Just echoing what China said, I think we have shared some of the worst days of residency together with this like black cloud thing. But I do think that you embody our residency's kind of like mantra where you always have done the right thing and has always stepped up and been sort of the ideal resident that I think juniors should look up to and medical students should aspire to be. So I'm really proud of you and really looking forward to see what happens.
Thanks, Sean. The other thing I was thinking about and didn't put in here is I think that people's black clouds are cumulative, and I think the two of us working together is one of the biggest examples of that throughout our junior years. I when I think about examples of being a black cloud, a lot of those examples involve you.
A superstorm.
A superstorm. There are other people who cancel out the cloud, but always one of the most supportive. Went through, like you said, some of the worst days still so far of residency. Appreciated you being there with me.
I just want to say thank you for both you and Kara for welcoming me and making this a great year, despite it being, tough because it's residency and whatever. But yeah, you've been a great example and super patient with me. And I was very excited to come up here and have you as my co-resident, but I don't think my idea lived up to the actual situation. So thank you.
Also, don't take any pictures together.
That's That's another superstition, actually. Some people think that you capture your soul in a picture.
Oh, okay. I'm sorry if I spoke any bad luck into existence. I'm actually on call tonight, so
Me, and I have a very white cloud.
everyone ends up having a busy call. I'm with you. Thank you.
I mean, thank you.
Good morning. For those of you who don't know me, I'm Ann Lowry. I'm an adjunct faculty and now clinically retired, but have the privilege still to be involved in surgical education and mentorship. I first met Shelbi as she was starting her research year. And in our first conversation, we identified a lot of similar life experiences and similar interests. And one of those was global surgery. And I really got to know Shelbi when we spent a week operating together every day and taking care of patients at One World Surgery in Honduras. And I learned that she is passionate about providing great clinical and technical care of patients. And we've continued our conversation since then. Shelbi graduated from Harvard University and went to the University of Illinois and Chicago Medical School, where she graduated with honors, and then came here to do her general surgery residency. And maybe she's going to tell us more about all those experiences. I know Shelbi as someone who is really passionate about providing the very best care for patients that we can. And as someone who really understands that that also involves taking care of our team and taking care of ourselves. And there's a lot in the last decade that's been written about that, but it's, in my experience, still largely been talk more than walking the walk. Surgery's got a ways to go still. But because I hadn't worked with Shelbi clinically for the last couple of years, I thought I ought to confirm that it's my impression of her. So, with a little help from a friend, we've solicited some comments from some of you, and they're not identified to me, so I don't know who I'm quoting. But, we got some really wonderful comments, but I just wanted to read a few. So Shelbi lives with unwavering integrity, consistently embodying her values and standing firmly in what she believes in. She prioritizes the well-being of her patients, her team, and herself, creating an environment where everyone around her is empowered to become the best version of themselves. Shelbi sets the standard for what a strong, caring leader can be. She's always been around to listen when things are tough or I need a debrief, but also holds me accountable to taking care of myself. I'm pretty sure I'll hear her voice in my head in and out of the OR for the rest of residency and my career. Shelbi is a fierce advocate for her fellow residents. She makes psychological safety for those on rotation with her and also in the same hospital as she is. She's one of the most emotionally intelligent individuals I've had the privilege of working with. As a junior resident, it's a real blessing to get to work with a chief resident who fully embodies this trait. Shelbi is kind and firm, and she expects excellence. All of this makes her a strong and approachable leader. She always has her finger on the pulse of what everyone's doing. This makes the team dynamic run much more smoothly, and it also helps us all feel like we truly matter. Shelbi inspires me every day, and she is one of my role models. I try to emulate her compassion and advocacy and confidence every day. So, I personally feel like I'd love it if people would say those things about me. So, Shelbi, congratulations on finishing your residency. I look forward to your talk and the rest of the journey of your career.
Thank you. That was more than I expected. And congrats to Rachel too. That was a lovely talk. I have very fond memories of us, especially when we were both on nights at different hospitals and we would do our weekly Friday morning breakfast debriefs, which was very good for my well-being personally. So today I'm going to talk about something that I am very passionate about outside of the hospital and have tried to bring into the hospital. It's intentional practice. So I think the word practice, when I was looking, when I was doing some research on this, a lot of you know I practice yoga outside of the hospital and have for many years. And the word practice there were a lot of similarities. We practice medicine and we practice yoga, and it's although very different fields, I think it's interesting that we kind of talk about it in the same way, that there's not really like an end point of what we do in medicine. We're always learning and growing, and the same thing is true of yoga. I don't have any disclosures. I will say yoga is part of an ancient lineage, and this is like the very tiniest brief overview of it. I would love to talk more offline about it, but I have the privilege of learning from some teachers who are part of really extensive lineages that trace back to some very early yoga teachings, but I am also new to the culture of yoga, and I am a white woman who grew up in the Midwest, so I am making no claims about being an expert in this, and I want to honor the ancient practice that exists. I think that we can all be a part of growing it, and I think it's really important that we do that. But I want to just acknowledge and give respect to the ancient practices and the teachers who brought it to our culture. Also, I do not speak Sanskrit, but I do like using some of the Sanskrit terms, so I apologize if my pronunciation is inaccurate and anybody notices that.
My name is Sanskrit.
So objectives, as part of an educational talk, the goals of this session will be that by the end you can briefly describe some types of yoga practice, you can describe the benefits, and you can identify some resources to grow your own practice. But instead of objectives, I'd actually like to talk more about intention. That's how we approach yoga practice. And it's more of an intention. It's more about, there's not really an end goal. It's just sort of what you are doing, what the theme of the class is, what we're working on, not necessarily like an end result that we're looking for. And so I'd like for us to set an intention today to have an open mind about an ancient holistic practice. Some of this might be a little bit different for us scientists, and I think my view on a lot of this is we are all, as humans, trying to explain the world around us, and we have different ways of doing that. And so the traditions of yoga are one way of trying to experience the world around us and explain it. And so if there's something that sounds unfamiliar to you, just keep an open mind about it and remember that we are all humans trying to understand what's going on. Okay. Oh shoot, I forgot my notebook. So we're actually going to do some experiential learning, which is, we're going to start out with a little practice. An asana, which is the physical practice of yoga. It's going to be super chill. Most of it will be sitting, but you can also, there'll be a little bit of standing. So I invite you all to join me. We're going to set our intention. We'll start seated, as you all are. We'll just do some gentle neck circles. So chin to chest. And then either way, you can just circle your neck around. Slowly. This is supposed to be like a warm-up. So don't push it too hard, but if one specific spot feels really nice, just kind of hold there for a little bit. Switch directions. If you'd like to close down your eyes, you can, if you feel safe doing so. Come back to center. And then we'll just take your hands. There's some joint movements. Again, just some light warm up. So we're really trying to send our energy into our joints doing this. So it's helpful to look at the joints that we're moving. So put your hands up in front of you and then just kind of back towards you, down. Do this a couple times. Again, looking at your wrist joints, imagine you're sending energy there. And then some circles of the wrists. Don't worry about the direction, but make sure you do both. Okay. And then we'll do some elbow release. So hands up on your shoulders, and you're actually just kind of gonna release the elbow joint quickly down. Don't hurt yourself. I should have put that in the disclosure. I'm not responsible for anything. You're doing this at your own risk. Okay. And then kind of shake it out. Shoulder rolls. So shoulders straight up towards your ears and then back and around. Okay. And then a couple forward. Okay. And then we'll kind of go into our intention. So I want to take a deep breath together. Hands to heart center. And our intention is an open mind and non-attachment to the outcome. So we'll take one deep breath together. So inhale up through the nose and exhale side out. Then we're going to do a little bit of a modified sun salutation. So I'll have everybody just stand up. You can stay where you're at. And then arms up. I know it's close, so you may hit your neighbors, but that's okay. Breath up, look up. And then hands toward center. Slowly sit back down into your seat. Then we'll take some seated cat-cow. So you can have your hands on your knees. And round your back as you inhale up. This is cat. Exhale, kind of arch your back. It's cow. Then inhale, cat. Kind of squeeze your belly button in. Exhale, cat. Couple more of those on your own. Come back to center. And then we'll do that one more time. So stand up, hands to the side. Big inhale, big stretch up. Exhale, hands through heart center, slowly sitting back down. And then some more cat cow. Inhale, arch your back, cat. Exhale, cat. Couple more of those. Then when you're ready, we'll transition to either a seated forward bend, or if you'd like to stand and fold forward, you can. But just kind of bending forward. Maybe if you're comfortable, hands on the chair in front of you to kind of stretch out. If you want to sit up and bend over and stretch your hamstrings and you feel like you have the space to, feel welcome. Take some deep breaths. In through the nose. And out through the mouth. Kind of twist side to side if that feels nice. Then come back to seated. So we'll stay seated, but do either eagle arms, or you can do hands to shoulders with your arms crossed. So eagle arms, we'll start with the right hand below the left. I don't know if I can even do it with my dress clothes on. Or this is a really good option, just kind of give yourself a hug. And as you're breathing deep into this, you want your elbows to kind of go up towards the sky. That gives you a better stretch on the back. It stretches out between the shoulder blades. We'll take 2 deep breaths here. And we'll do the other side. So opposite hand under. And I mean, it might be like this, that's fine. A big hug. It's okay if you have an audible breath. And then bring your hands back to heart center. A gentle twist. So twist towards your right shoulder back. If you want to put a hand on your knee to kind of help guide the twist, that's nice. This is supposed to be a very gentle twist, so don't like crank your back. If you feel a little bit of a twist, just that's great. That's perfect right where you are. It should not be painful. Inhale back to center. Twist the other way. Same thing if you want to put a hand on the knee or around your hip to kind of facilitate it. We're just looking for a stretch here. Not painful. There's no who can twist the furthest. I know that it's hard for all of you surgeons, but it's not a competition. If you're feeling a stretch, you're doing it right. Then inhale back to center. If you feel comfortable in your dress clothes, you can grab your knee and kind of pull it up towards your shoulder. Either one, maybe start with the right. Just a little stretch. Deep breath. When you inhale, pull a little closer. I'll switch to the other side. Inhale up. And release. All right. And then to close out this brief asana, we'll take 3 deep breaths together. So hands to heart center. If you feel comfortable and safe, close down your eyes. We're going to take a deep breath in through the nose and exhale out through the mouth. 2 more times. Inhale. Exhale, side out. Last one. In. Really expand your lungs. Maybe take an extra little sip of air. And side out. Open your eyes. Come back to the room. We'll transition back into a little more talk about me, I guess. So this is my journey to yoga. I played softball my whole life. I was an athlete from my early days. I tried dancing and I was really bad at it. So my parents never signed me up again. But I was good at softball and I liked it because you could run really fast for a very brief moment and then you got to rest and take a water break. So that was really fun. This photo on the side is when my ceremony at high school when I decided to go to Harvard, and some of my really influential coaches, especially my strength coaches, so, that helped me get there. This is my college softball coach, Jenny Allard. She has been an amazing mentor for me and just a wonderful, strong woman who really helped me get to where I am now. But when I graduated college, I pretty much wanted nothing to do with the weight room ever again. And I wanted to leave and go very far away. So I went to this tiny little island called Koshrai, part of the Federated States of Micronesia, and I taught high school science for a year. If you know Matt Robertson, fun fact, this is where he did his mission service as well, his Mormon mission. At a different time, so we never knew each other, but small world. This is my host family in the large photo, and then some of my students when they graduated. And I kind of continued to grow my yoga practice outside the hospital or outside of work there. And then I decided to go to medical school. This is the beginning, my white coat ceremony. You're all happy and excited. And then it became this. A lot of, we called them board reviews because we would just get together and write all of these things on the whiteboard to study them. Lots and lots of them. And then I needed an escape. So I would go to yoga. And I loved it. So I started going to special workshops. This is from a headstand workshop that I went to. So I want to kind of address a lot of misconceptions about yoga that people have said to me and that I have learned are not necessarily true. So you have to be flexible to do yoga. That is not true. There's no goal of flexibility, and there's no specific shape that you have to make. There's a misconception that it is a physical practice. There is a physical practice, asana, but I'll talk a little bit more about why that's only one small piece of the overall practice. That the goal is to create a perfect shape. It is not, you will see what the ideal shape is if you look up these different poses, but it's really more about how you feel in your body. Actually, there's meditation involved, there's breath work. Sometimes it looks like this. This isn't a perfect shape. It's one step on the way to a different shape. Sometimes it looks like this, where you're falling out of your yoga pose and you're trying to pose so that you have a nice Instagram photo. But you fall out, and that's okay, and that's all part of the practice and part of the growth. Sometimes it looks like this, where you are not flexible because you haven't stretched, and it's just kind of this unnamed pose. But it's the practice of doing it that is really where the benefit is. And then another piece is that meditation is quieting the mind. It's not necessarily, the goal isn't necessarily to make it quiet, but to observe your thoughts and sort of disconnect from them. So for me, yoga was an escape. It was the only time in medical school when I was truly in the moment, which is kind of why I really fell in love with it. And then I noticed I had an injury, a lingering injury from college that caused that I required a lot of physical therapy in medical school, and I started noticing that a lot of what I was doing in physical therapy I was also doing in yoga practice, and so it was a nice way to just not have to go to physical therapy forever, but like continue to keep up with the exercises that were helping me. Okay, you guys are all scientists or surgeons. You want to see the evidence, so I put some in here for you. Yoga has actually been studied in a wide variety of things in medicine. Cancer survivors, cardiovascular health, low back pain, anxiety, depression, burnout, opioid withdrawal, MI recovery, stroke, lowering cholesterol. So you can go find those things if you're interested in it. But here's some specific studies. This was a study that looked at CBT alone or CBT and yoga, and they had lower depressive and anxiety symptoms post-intervention, so with yoga and CBT rather than CBT alone, and a quicker reduction, and it also was a sustained finding over time. So it might help patients or you if you have anxiety and depression. There are a few systematic reviews. So in 30 experimental studies, interventions that included yoga improved stress, anxiety, and depression. How does it work? So we're saying it improves these symptoms, but like what's actually going on in the body? This looked at yoga versus running versus sedentary. And the yoga group had lower respiratory rate and heart rate than both groups. So lower than the running group as well, and lower diastolic blood pressures than the sedentary group. And then heart rate variation, which is a measure of cardiovascular and stress, actually went back to normal after an imposed stress in people who did yoga and in runners. It did not go back to normal after after a stressor in the patients who were sedentary. This is another systematic review that the yoga intervention was superior to controls in reducing anxiety and depression, and the symptoms were also decreased. Hatha yoga, which is my preferred practice of yoga and what I'm most trained in, they studied that specifically, and heart rate variation. Is a marker, again, of parasympathetic predominance, and the yoga group had multiple other markers as well. And they didn't specifically draw conclusions from this study, but impaired heart rate variation is known to be associated with increased cardiac morbidity and mortality. And so this is a way potentially that you can decrease your risk if you can make some changes in heart rate variability. There's studies on a specific type of breath work, Bhastrika pranayama, and this was an fMRI study. So they actually looked at how the brain is functioning, and it decreased states of anxiety and negative affect and modulated the amygdala and some other parts of the brain that I'm less familiar with, but I know that you all know that the amygdala is associated with fear response and stress in the limbic system. Increased heart rate variability and respiratory sinus arrhythmia, again, parasympathetic activation. So people are having more parasympathetic activation at rest and in response to stressors. For your patients, it reduces blood pressure, actually. Greater reduction in ones that included breathing techniques specifically, or pranayama, and then larger reductions in diastolic with meditation or relaxation practices. There were greater changes in people who had a higher baseline blood pressure. For us, there's some studies in surgeons specifically. Interventions do effectively increase mindfulness, and they improve executive function, surgical skills, communication, and career progression. So it might make you a better surgeon. Specific benefits. So one study even looked at motor parameters. So the peg transfer and circle cutting that we are all too familiar with and will never use again after we leave residency. People had decreased number of unachieved movements, so they were more efficient, and they used less suture when they were suturing. Their perceived stress is also lower. Every study that measured mindfulness was higher than the baseline, and executive cognitive function was also higher. Depression actually increased in the control group during the study, while resilience and grit were higher in the intervention groups. Those ones were a little bit smaller difference, but lower rates of emotional exhaustion, depersonalization, lower rates of burnout. And then there's also, when they looked at stress stimulated pathways in RNA analysis, circulating blood samples, there was a significant reduction in markers of stress. So another RCT, stress, anxiety, depression, lower, decrease in insomnia, which I know it can be hard, especially our sleep schedules are really messed up in residency and in surgery careers in general. So maybe it'll help your insomnia. You might have increased professional fulfillment, less exhausted. And then I found this study that was really interesting. Even one single session can reduce acute stress reactivity. This didn't go into sustained effects, but at least you could do one session and maybe it makes you a little less reactive on your call shift that night. And reduction in cortisol. So some specific breath practices. Okay, so hopefully you believe me now. But here are I want to go through some practices that you can actually take with you. This is something that became really apparent to me after I did my yoga teacher training during my research year, which was I didn't expect to find, but I realized I learned how to teach breathing, and it's something that we talk about with our patients all the time. Nobody really knows what you mean. You're like, just like keep breathing, take a deep breath. You're like pulling the JP drain out or whatever, or they're like having an anxiety attack and like nobody really does it. You're like, oh, like slow down, take slow deep breaths, and they just like keep. So so I'm gonna give you a little tool, hopefully, that you can use. It's the first one is very simple. It's circle breathing or one-to-one breath. So instead of just saying like take a deep breath or like take slow breaths, you can count not just the breaths but the amount of time. So, and this can be variable, but the goal is the same: inhale and exhale. That's why it's called circle breathing. So you can say inhale for 3, 1, 2, 3. Exhale for 3, 2, 1. And you can do this for yourself or for your patients to actually help them slow down. You can do just 1, 2 if they're breathing really quickly. And I've actually found this to be really helpful. Obviously, it's anecdotal evidence, but it has seemed to work for me as a way to actually give people something to focus on. And again, you can use it yourself too. Another thing that I really like is this third breath. So you can do it on the exhale for calming or on the inhale if you're trying to build energy. So calming, so you would take a deep breath in, exhale a third of your breath, brief pause, exhale a third of your breath, brief pause, exhale the rest. So we'll do a couple together. So inhale, full breath in, exhale a third, pause, exhale a third, pause, exhale a third. Inhale all the way in. One smooth breath. Exhale third. Exhale third. Pause. Exhale it out. So that's just kind of a brief one. I use that for me personally a lot if I'm feeling really worked up and can be a nice practice. So more specifics about yoga. What is yoga? It comes from a Sanskrit word which means to unite or integrate, which is really a means of uniting mind, body, and spirit. Yoga in the West was really, it's got a long history. I didn't include everything before, but it came to the West in the 1900s. In the 1930s, it was initially a movement for health and vegetarianism. And then in the 1960s, there was a large influx of teachers that came from India. There was even some chanting at Woodstock. And then in the 1970s, Kundalini yoga really took off, which a lot of our modern Western variations of yoga are adapted from. So there's a lot of different yoga practices. This is not an exhaustive list, but is some that you might be familiar with or may see out in the world when you look. So Ashtanga is really a set series of poses. It's physically demanding, but there's some derivations that are very popular. Power yoga, vinyasa yoga. So this is like your core power, or I'm trying to blank on. There's another one that I'm thinking of, but a lot of yoga practice is derived from Ashtanga, Iyengar, which is where a lot of our detail and alignment of poses comes from, and the use of props. They really emphasize proper positioning. Kundalini, the idea is this controlled release of Kundalini energy, which I'll talk about a little bit more later, and the coordination of breath, movement, and meditation. There's restorative yoga, which a lot of people kind of will use restorative and yin to mean the same thing. They're technically not, but you may go to a restorative class and actually be practicing yin yoga. The true restorative is long poses, but it's really light and like not physically demanding. The goal is to allow you to rest and build ojas, which is just kind of like a life force or like energy. It's kind of the idea of fill your own cup first. Like this is filling your cup. Vinyasa or flow yoga is really stringing poses together. So it's a flow between poses as opposed to doing a pose and then switching to another pose and holding and switching to another pose and holding. That's more Hatha yoga. Yin yoga incorporates some traditional Chinese medicine concepts. This is long holds. The goal is stretching though. This is a little bit, it's slow, but it's more intense than a restorative yoga. So it's more of like, you're really trying to get a very deep stretch. And so it can be a little bit, not bad painful, but it's a deep stretch that it can be difficult to hold a deep stretch for a long time. The 8 limbs of yoga. So this is from the Ashtanga lineage and is what my teacher training mostly is in. So the first limb is yamas, or self-restraints. This guides our relationships to others. So yoga is really kind of a life practice or a total spiritual practice, a holistic practice. So the yamas and niyamas are sort of the ethics of yoga. I'll go into that a little bit more in detail in the next slide. Asana is the third one, which is movement. That's what most of us are familiar with. That's if you go to a yoga class here, that's what you're going to get. Pranayama is the breath. Breathing techniques, control of the breath holds. And then pratyahara is withdrawal of the senses. So you're bringing your attention inward. This is sort of the beginning of meditation or the idea of meditation, but it's really just that you're kind of paying less attention to everything that's going on outside and focusing on yourself and what's going on. Dharana is steadying the mind. So this is really what the first step of what we kind of refer to as meditation. It's that you're concentrating on a singular thing. That can be anything at all, but focusing on a singular thing. And then dhyana is sort of building on that. That's more of what we think of as true meditation. Although it's not like we talk about, oh, I'm going to go meditate. Well, that's not technically accurate because meditation sort of comes with time, like if you're truly in a meditative state. But dhyana is like when you get to that point, you're keeping the mind single pointed on one thing and you're really able to sustain that. And then samadhi is sort of the great realization or ecstasy, absorption. This is something that you cannot practice in a traditional way. It's sort of like something that happens to you. People talk about this also as like a Kundalini awakening or transcendence. The idea of that. It arises spontaneously when you are sitting to singular focus. Ethics of yoga. So the yamas and niyamas, ahimsa, nonviolence. So we're trying not to hurt people, and we're also trying, and not just people, but plants, things, the world around us. Satya, truthfulness. But these all go together. So it's not saying that you're, going to be mean and tell someone just because it's the truth. Like, it's not that you tell the truth at all costs. It's that the intention is to be truthful to yourself and to others, but you're also being nonviolent, so you're trying not to hurt them. Non-stealing, both in real terms, physical terms, but also you don't want to be stealing others' time, or I think that's the best example. You don't want to waste other people's time or resources also. Brahmacharya is preserving energy for spiritual practice. A lot of times this is referred to specifically in terms of sexual activity and kind of preserving that, or being just, the idea though is saving your energy and so that you can spend it in building yourself and your spiritual practice. Aparigraha, non-greed. Niyamas are more like our relationship to the outside world. So cleanliness, both mental and physical. Santosha is contentment. I really like this one. It's like accepting the current situation. Not in the sense that like, oh, I can't do anything about it, but that like, I am okay. The world is okay. Like, this is how it is. We can do things to improve it, but kind of sitting and being upset about the moment is not really helping anyone. Tapas, discipline and commitment. I think we all understand that as surgeons. Svadhyaya, spiritual self-education, so continuing to practice with time and contemplation. Isvara Pranidhana is surrender to supreme being or higher principle. This is sort of the true spirituality of it. So in whatever way, there's not a specific it's not a religion in the way that like Hinduism or Buddhism is. You're not praying to gods or goddesses, but there is this sort of belief that we are all part of something bigger, and like being humble in that and knowing that, you know, the whole world isn't about me and I am part of something bigger that maybe I don't understand, and just letting that be. So some yoga anatomy. This is the particular thing that I think is a little hard for us to grasp as medical professionals. But we talk about the subtle body in yoga. So the flow of prana, which is hard to describe in English exactly what prana is, but you can think of it as energy or sort of the life force that's flowing through us. There are a lot of pathways for this, but Ida, Pingala, and Sushumna are like the main ones, and you may have seen something similar to this image before, but also it looks very similar to the medical scepter, so which again is another interesting parallel. Ida starts and ends on the left. This is the feminine or the lunar energy. Pingala is on the right. It's the male or the solar energy. And both of these are really important. You know, we need light and brightness and energy, but we also need to relax and be calm and that type of energy as well. And these interact, these are the two that cross. They come together at the chakras. I'm not going to go into detail about those, but they basically are valves where the prana could be stopped. So think of it as a valve or a sphincter, perhaps, where energy can go up or down. This is also, there are other spiritual practices that use chakras, but they actually correlate to nerve ganglia. So this, again, is a way that people have found to explain the world around them. And so I think that there's something there that we don't fully understand about our bodies and the energy that's flowing, but there are some correlations to medical practice that we know to be true, and this is just a different way of explaining that. Sushumna is the one that goes straight up through the spinal column and goes through the chakras. There are multiple different practices that you can do to balance the Ida and the Pingala, or if you are you're in a yoga class and at the end of class they tell you to turn one way or another, that's related to this. And the practice I like is if you feel like when you're laying there, one nostril is more closed than the other, turn towards the other side. So that one's on top, basically. If your right is on top, you want to roll to your left. The idea is that by doing that, you will help open up that energy. Okay, we're going to do a short meditation practice, if you guys are up for it. This is called an Antakarana meditation. I really like it. There's a lot of meditation practices. I know that some of you may not be familiar with this, or this might feel scary to be alone with your own thoughts. I think that's a reason you all should do it more. But I think if that's you, the best thing to do if you're interested in this is something that's very guided and gives you something to think about the whole time, as opposed to like just trying to sit in silence for 5 minutes. That's not gonna go well for you. So find yourself a comfortable seated position. You want your head, neck, and trunk in a straight line. Often it's helpful to go a little towards the front of the seat so your feet are firmly on the ground and you're kind of sitting upright as opposed to like slouching back into the back of the chair. Hands on the knees, if you hands, palms facing up to take in more energy if that's what you feel you need today. Palms down if you feel like you need some grounding today. Close your eyes if it feels safe to do so. Bring your attention to the farthest sound you can hear. Try to hone in on that. Now, bring your attention to the space that you're in. Are there sounds in the room? Do you feel any movement of air? Do you notice a temperature? Maybe there's a smell. Just noticing what's going on around you. Now bring your attention to the surface of your skin. The texture of what's touching your skin, what you're wearing, maybe how your hair is falling, the feeling of the seat underneath you. Is there any movement you can feel on your skin? Bring your focus a little deeper. Are there any internal sounds coming from your body? Is your body moving with your breath? What is that like? Is your chest moving up and down? Are you feeling it more in your belly? Is there any areas of pain or soreness or tightness? Can you feel any digestion happening or any sounds of digestion? Maybe you can feel or hear your heartbeat. Then bring your focus to your breath. Watch it move in and out. Maybe hear it move in and out. Maybe feel it in your upper lip. And then turn your attention to the space between the breaths. What's coming up for you? And observe the mind itself. Any thoughts or feelings, just notice. Oh, that's an interesting thought I'm having. If that's too much, or you feel like you're losing your thoughts a little bit, you're getting a little attached to them, maybe going off following one, just come back to the breath. Pay attention to the inhale and the exhale, and that specific space where the inhale turns into an exhale. Sit with this practice for a few more moments. When you're ready, wiggle your fingers and your toes. Maybe open and close your jaw. Deepen your breath and come back to the room. And you can open your eyes, rub your hands together, warm them up. And you can put them over your eyes. This feels really nice. Maybe over your ears. A little warmth in your neck. Now I've just got some stuff about me, and some thank yous. So this is me as a baby. I was born in Dallas, Texas, to Mark and Jody Olson. I clearly was a fan of being out in the snow at an early age. I've got a similar photo of me from this year. Always loved animals, loved dogs, loved having sweet treats, as you can see. I drew this in kindergarten, which is funny because then in high school I was like, nah, I don't want to go to medical school. That sounds dumb. I wanted to be a pediatrician, which I learned that word as a kindergartner, and everyone thought that I was really smart as a kid because I said pediatrician. I think this looks more like a surgeon, though, with a patient asleep on the operating room table, which is clearly where I ended up. These are my parents, Mark and Jody Olson. They still live in Kansas City. My dad was born in a small town in Wisconsin on a farm, and my mom was actually born in Germany. My grandpa was in the military, and she was born in Germany, and then but mostly grew up in Iowa. Moved around a little bit as a kid. Went to high school in Iowa, and now they live in Kansas City. The photo on the right is my grandparents, Donna and Tom Cole, who have been the best supporters for me my entire life. Anyone coming to graduation will get to meet my grandmother. She will be here, and I'm very excited. Unfortunately, my grandpa passed away a couple of years ago, but I was fortunate enough to be on my research year at the time, and so I got to spend a lot of time with him. They have been the best supporters for me my whole life, and I would not be here without them for sure. Here's some more photos of my family. Some big photos of me and all my cousins with my grandma from both sides, my grandparents again, and some more of my cousins. I am the youngest of the cousins, although because of that, all of my cousins, I think, well, not all of them, almost all my cousins have kids now, so I'm now sort of like somewhere in the middle. And then this is a photo. Then we get to kind of the hard times, and then I'll do some shout outs as well. But this is a photo of many of the places that I have cried during residency. Not exhaustive, but a long place. This bench you may recognize from I don't know if you can see this, but you may recognize from Regent's Hospital. This is one of my favorite places to cry. I have taken multiple residents there and showed them this spot. So that's my bench. You can remember me forever. I do not have an exhaustive list of thank yous. I just have a few specific shout outs. I don't have a photo of you, Dr. Lowry, on here, but it has been a real pleasure to get to know you and learn from you, and I am so thankful to have you, and I will continue to call you for the rest of my career. A few people from the U. I want to give a special shout out to Afonwe and Michelle, especially this year, have been really supportive of the EGS team. And Afonwe in particular will get any patient out of the hospital. I don't know how she does it, but she has some sort of magic that she sprinkles. Dr. McCormick-Deaton, Dr. Kendrick, and Dr. McEachran, I have learned a lot from operatively. You guys have given me a ton of autonomy and allowed me to really grow, and then also have allowed me to have a lot of conversations outside of the operating room, and I've grown a lot from that. Dr. Akramidin has been a great support for me when I had a really difficult time at the end of my third year. He gave me a lot of personal and professional support, and I am immensely grateful for that. Genevieve Melton-Mukes, I'm excited to spend some more time with as I'm going into my clinical informatics fellowship, but she has also been an immense personal and professional supporter. So a special thank you to her. Some of the people at North Memorial that I have again been able to operate with pretty much independently, which is the biggest thing I can ask for as a chief resident. And then Dr. Nugent, who I worked with as a junior resident and continue to call frequently and will forever. You have been an amazing supporter and friend, and thank you for that. All of the people at Methodist, again, I know how to operate because of you guys, I think. This is a fun photo of Bella Dennis gowning and gloving me in the operating room one day, which we did for an Instagram photo. But he was such a good support, and I think always is a support of residents and makes it a fun time. The ACS service and the colorectal surgeons at Methodist have taught me a lot of what I know about surgery, and I actually plan to do a lot of things exactly the way that they taught me. So I really appreciate all of their help. Regions, again, not an exhaustive list, but some of the people who have been incredible. The APPs, Megan Goff you're an amazing friend and colleague and will continue to be. And then especially some of the APPs on the general surgery service treated me with such respect and were just so kind and treated me like an attending, and that allowed me to grow in a great way. Dr. Wolpert, I love operating with you, and you're just a joy to be around. Dr. Tomlinson has helped me find a path to locums within general surgery, a way to practice while I'm doing my clinical informatics fellowship. So I'm grateful for that. And then Dr. Fox, Dr. Haas, and Dr. Holden, again, on the general surgery service, taught me a lot and continue to be supportive for me and answer my phone calls when I need to debrief a case or have a question about like the worst hernia I've ever seen. The trauma critical care staff, Dr. Meyer and Ieha, again, a ton of operative autonomy, a ton of teaching. Dr. Keck is a badass, and I hope that people see me like her someday. Shika and Lyle were both my chief residents, and I was so excited to have them as attendings, and they have proved to be very fun to be around and operate with, and also, again, just let me operate and pushed me to be better. Dr. Bennett, I cried in his office as a third year, and he did everything that he could to support me and get me through a really tough time. And I am endlessly grateful for that. I honestly don't know what I would have done without his support at the end of my third year. To all of the residents, I found a few fun photos, a lot of Cheetah Print Fridays. Thank you all for doing that with me. I love operating with you all. I love hanging out with you outside the hospital. I love going to women's sports games with you. And I hope that we all stay friends after all this. I'll still be here. A special shout out to my original class, especially Julia Harrison and Lindsay Welton. You guys have been some of the best friends that I could ask for. And I'm not going to say anything else because I'm going to cry. But also, it's been a real joy watching Lindsay's family grow. And getting photos of Calvin like this really make a bad day better. So thank you for that, and keep sending them. My current class, our group chat, I'm sure will keep going forever. With you guys answer my clinical questions, you answer my stupid questions, and you make me a better person, and I learn a lot from you all every day. It's been a real joy to work with you guys. I love you. This is my yoga sangha, which is just sort of a community, and Tanya Boyganzon in the upper right is my teacher. She's the one who ran the yoga teacher training, but also the rest of the people photographed here around the outside are my teachers, and the group photo in the middle is my teacher training cohort. It sounds really dramatic, but the teacher training changed my life in a lot of ways, and these people have taught me so much about life, and it's been a real pleasure to be a community of something outside of medicine, and they all are just endlessly supportive of me in my yoga practice and understanding of my job as well. Let's see. These are my best friends from medical school, the people that I go on an annual trip that you all get to hear about every year. I advise you all to find some people like this. There's a gynecologist, an internal medicine hospitalist, and a child psychiatrist. So we've got a lot of the specialties covered for questions that come up in the hospital without having to call and do an official consult. Plus, they are the funniest people I've ever met in my life, and I love them. They have gotten me through a lot. This is Mario, my boyfriend. We met at the beginning or at the end of second year, and I don't know how he put up with me through like our first year of dating as a third year resident. It was terrible, and he's still here. He gets a huge thank you for sticking around, and I mean, you all know how hard our jobs are and how hard it is to be a partner of us. And then there's a little picture of Jordy snuck in there. Here's some unsolicited advice that I don't know. Rachel said it was semi-solicited, so I guess that's true. But go to therapy. Everyone needs therapy. Everyone in this department needs therapy. If you think you don't need therapy, so go. If you need help finding a therapist, I can tell you what I did. It is harder than it seems, so I acknowledge that. But it's really important, so do it. Cry when you can. You got to get the emotions out. Don't chart stock at home. You know who you are. It's bad for your mental health. Stop doing it. And if you're doing it, don't text me about it. Find your Sangha and hang on tight. So again, yoga group, but can be, just your community of support and friends. And then always say yes when someone offers to buy you food. They'll keep offering. That is it. Sorry, I think it was long.
Been the beneficiary of Shelbi in like all the ways. So as a wonderful co-resident and co-chief, and as a friend, and as a yoga teacher. If you haven't gone and done a session of yoga with Shelbi by the lake, you have not lived. She'll never tell you to just empty your mind, which just is the most anxiety-provoking sentence that anyone has ever said. You have made residency and my life better, and I truly appreciate you.
Shelbi, my current class knows that I framed my entire fourth year schedule around when we could overlap at sites. That is not only because I consider you such a dear friend, but also because I look up to you and how you carry yourself. So I will start crying now. But I just wanted to say I'm very proud of you and thankful for you.
Hearing how Dr. Lowry talked about your junior residents feel about you, I wish I had been your junior resident. I feel like I missed out, but it's been a real joy having you as a colleague. Dr. Lowry apologized because she had to go catch a flight, but she told me to send you a text. I'm also very proud of you. What a joy to be a colleague with you tomorrow. And thank you for the free yoga practice, because I would normally have to pay for that. That was great.
I mean, I will accept payment.
Buy her food.
I will accept food.
Yes. I do have a question though. So one of the things that yoga kind of overlaps with is a lot of other things that maybe as surgeons we should be doing more frequently, like massages or acupuncture. You talked about CBT a good bit. Do you know anything about, I'm thinking about it because I'm getting a massage tomorrow, like the benefits of massage and or yoga as far as like physical health for surgeons?
That is a good question. I have not looked into it myself, so I don't know, but
it's outside the scope, but I was just
curious. And there is quite a bit of overlap in the yoga community. There are a lot of people who are massage therapists and yoga teachers. And there's also at Dave and Adi, where I did my yoga teacher training. They do Thai yoga body work, which is a little bit different than massage, but also kind of a assisted physical practice so there's quite a bit of overlap, but I don't know the literature.
I remember I think it was residency interviews, I had a lot of people that I interviewed with because I had yoga as an interest of mine on my CV. They talked about how they did yoga and how important they thought it was for their physical and mental well-being. So this is like excellent full circle because that was many years ago. It's a great talk.
Yeah.
I think I can, well, I don't know. I'm going to speak for the intern class, but if they don't like it, they can say something. I feel like I was so lucky to get to do my very first rotation with you because I think one of the greatest gifts you gave me early on was like figuring out how to at least try to be confident and trust myself and my judgment. And I think that has carried forward. And often when I find myself like, I don't know, or going back and forth, I think it was like Shelby would tell me to just like go with my gut or that I know what I'm doing and that and so like I hear your voice quite often. I'm like, she would tell me to
just wait
trust myself.
Next week when the new interns start, you'll really know.
So thank you for that. It really was a gift.
I do have a question, but
Yeah.
I will also echo many of the things people said. Me personally, I think that, especially in this job, you need to vent and try to find the right people to vent to. I'm lucky, I think in our class we have mix, but I definitely think you're one of the people who I relate with the most and probably tell you the most. So thank you for always being there to do that. You kind of alluded to it, but for our profession, especially in our situation as residents, everyone needs a therapist, as you say. And it is tough. So I don't know, it might be better offline if people want to ask you, but what do you recommend in terms of like for everyone here trying to find someone?
So we do have I don't know what it's called now, but the residency assist program or whatever. There's a phone number, I think, which is how I found my therapist. I did go through a couple of people before getting to this one that is amazing. But it gives you 8 free sessions, or at least it used to. And I said, like, basically my schedule is garbage and I need someone that has weird hours and can do online therapy. And that ended up sending me to BetterHelp, which when you get the 8 free sessions is great, but the cost of it afterwards, honestly, is not great because it's typically not covered by insurance and it requires a subscription, which I think is stupid. But anyway, but I found my therapist through there, and then she also sees patients outside of that app, and I think that's a fairly common thing. I don't know for sure. And so I ended up just like transitioning to not using the app, but seeing the same therapist. But I think the biggest thing is finding someone that has hours that are, maybe not normal. And I think it's really helpful to do it online because, if you get home at the last minute, you can still log on. And someone that doesn't charge you for like missed or late appointments. All these things are hard to find and things that I dealt with. Like intern here, I had someone that I kept getting charged for missed appointments and I ended up saying, okay, I'm just not going to see you anymore because it's not worth it. So it is a challenge. I think BetterHelp, like I said, is not like nothing is perfect. There's a couple of other apps and I think don't quote me on this, but I saw recently one that does take insurance. But starting out there in terms of accessibility might be the best way to get started. Otherwise, asking people that you know who have good therapists, and if those therapists know anyone, that's my advice.
I think a short break to stretch our legs and then we'll go right into work.
Trying to take care of like not expecting that. I was like,
I saw it when I was doing my shoulder turn, you know?
I always forget to. That's how my M&M attendance is because my core attendance is like 90. Attendance is like, and you're like, I never do. I know. So I'm always